Curodont repair is the first brush-on treatment for tooth decay that doesn't require a needle or a drill, doesn't stain, doesn't taste bad.
Once you drill a tooth, it can go on and on for the rest of your life.
You leave it open to needing future dental work like a root canal or a crown as the structure of the tooth becomes weakened. Families are usually very receptive to Curodont. They're happy to know that they won't have to get the tooth drilled.
If we catch it early and apply the Curodont, you can avoid many years of repairing the same tooth over and over again.
So when you have an initial caries lesion, you've lost some mineral in the tooth. It doesn't evenly dissolve. What happens is you get little holes in the tooth, little microcavities. And so for those missing portions, pretty early on, they get too big to just fill in with fluoride or something like that. And so you need something to bridge across those little microcavities. You need something bigger. What Curodont repair does is it soaks in, it makes those bridges, and then it uses the calcium and phosphate from your own saliva and makes hydroxyapatite within the lesion, just like when the enamel is first forming. The tooth is made of hydroxyapatite, so literally what you're doing with this peptide is you're making hydroxyapatite where it's missing, using the same concepts in chemistry that our bodies use to make enamel in the first place. So this is really a big revolution in dentistry, where we're able to use medical approaches so that you don't have to have surgical approaches. To treat tooth decay in the past, you had to remove tooth structure. If you don't have to remove tooth structure to treat tooth decay, that opens up the ability for non-dentists to treat caries. That's provocative.
For hygienists to learn to apply Curodont, it's pretty easy. I think we did a session here that took maybe like 30 minutes. We went over and kind of ran through it a couple times, and everyone was pretty much on board.
The actual Curodont treatment takes about 5 minutes. For myself as a hygienist, it's very quick, it's very easy, it doesn't take up much of your appointment time.
When applying Curodont, you want to make sure that the tooth is cleaned well first, and we do that by cleaning out the tooth and etching. You really want to dry it so that way when we place the Curodont, the peptide is able to be absorbed into the tooth.
Then we paint on the Curodont. And just wait for 3 minutes.
It's easy for the patient, it's easy for the hygienist or the dentist, whoever is applying.
The patient would only need that one application. They don't need to come back. It's very important for the patient to keep the areas clean. They need to be flossing, brushing well, keeping that bacteria out of there as much as possible for the best results.
So the differences between Curodont and either silver diamond fluoride or sealants are that sealants are usually used in the back teeth. It fills in the grooves of the teeth to help prevent food and bacteria from sticking into those grooves, so it kind of creates a barrier. Silver diamond fluoride is similar to Curodont, where we just paint it on the tooth, but it does leave a stain long term. So Curodont is different from those two because it doesn't leave staining, and then it can be used more in the front teeth.
Curodont repair, thankfully, is very safe. One of the really exciting parts about safety, which is really well established with peptides in general, and this peptide specifically, is that as soon as it gets out of its site of action, if it gets onto the saliva, if it's swallowed or anything, the body knows how to deal with peptides. It just breaks them down into their component parts. And the amino acids becomes food. So there's nothing sort of artificial about that process. So it's very safe.
There's one potential side effect of causing some sensitivity on the roots, but the product is not indicated for that. So if you use it where it's supposed to be used, then you shouldn't have that problem. I think over the next several years, Curodont will allow us to kind of move away from like traditional drilling and filling of teeth and allow more people to have access to preventative and comprehensive dental care.
Just like in medicine, we used to have physicians and surgeons and that was it. Now there's a whole wide spectrum of clinical care. We're going to be seeing that in 10 years in oral health. And it's going to be thanks to innovations like Curodont Repair.
I kind of got into this profession because I don't like kind of disparity in oral health that we see, and there's, different populations don't receive the same amount of care. So having a product like Curodont that's easily accessible and that we can kind of get to all different communities makes me happy, and being able to provide that, I think, is a great service.
Dentists want to help their patients. Dentists want to provide a therapy for this disease that they see. When the only option that they have is a filling, that's what they're going to do. Now they have another option. That's the real opportunity of Curodont Repair.